40, I think here too. So it should be fine. Okay.
Okay, I think we're ready.
Okay.
All right, everybody, I've been told everybody is ready at the office side of it, and everybody, I've been told everybody is ready at the office side of it, and that was my fault again, sorry. I have heard Commissioner Peck, Commissioner Didier online. Yes, sir. All right, thanks. We have all three commissioners. We have Keith in the office and Karen on the computer. With that, we will call our meeting to order for Tuesday, October 6th for a regular board meeting. So with that, we will start with the Pledge of Allegiance, please.
I pledge
Allegiance
to the
to
flag
the flag
of the United States of America and to the republic for which it stands, one nation,
one nation, under God,
liberty and justice for all.
justice for all.
Thank you. Our first item on the agenda this morning is approval of minutes for September 22nd of 2020 commissional meeting minutes. Any addition, changes, or corrections? Okay. Did I hear a yay from both? Yes. Okay, thank you. With that, we'll go right into our 2021 employee benefits presented by Conover, please.
may
And they're
not
getting
be able to show the thing.
Let me try something.
Okay, so I turned it back to meeting in progress. Can anybody tell me if they still hear us?
There's no sound on either YouTube or AV capture.
Okay, can we go into a recess?
Okay, recess for,
Oh, she said sound is back. So maybe it was putting up the Conover thing that's caused it.
Okay, so it's back on. We're not going to have the documentation then on the video feed. They'll just be able to hear the audio. So with that, Dave, go ahead, continue.
So again, we're back on page 3 at the bottom section. What I communicated as far as renewal action with the committee, I used carbine language in describing this process. Primera has a preliminary renewal of 36.2% increase. Think of that as like MSRP when you're buying a car. Their initial renewal of 19.9%, that's kind of like the dealer saying, hey, this car's on sale. And then we finally negotiated the renewal down to a 15% increase, which based on the year you've had is more than fair. Any questions on page 3?
commissioners, do you have this PowerPoint coming up?
Commissioner Peck, yes, I can see it, and when it's appropriate, I have a quick question for Dave.
Sure.
Clint,
Yes, Chairman, I have my book and it's printed out and I'm following along.
good, thank you. Okay, go ahead, Commissioner.
Dave, not to get into a lot of detail or even to back up, but those loss ratios with a combined loss of 100%, I think it's the first time I've ever seen anything that dramatic on this topic in ever. Are these insurers, folks providing the coverage, to your knowledge, are they getting any sort of federal assistance or aid that might give a different picture if we knew about it?
I'm not sure I understand your question, Commissioner Peck.
Well, I'm looking at a combined loss ratio here of 100%. If the federal government is backstopping these providers to some amount, their actual loss could be a great deal less. I'm just asking if they're getting subsidies from government agencies, state and or federal, that would make these numbers different. Or another way to say it is, if there's any state or federal government subsidy going to these providers, are those dollars included in this data?
Okay, thank you. So for groups over 100 employees, there are no subsidies. Health plans that participate in the exchanges or the Obamacare plans in the individual marketplace do get subsidies. So this is reflective of just pure Franklin County data.
So to your knowledge, no COVID-related federal subsidies to help them make up for hard financial times?
Correct.
Okay, thank you.
Okay, so now if we go to page 4, we're going to talk about what's really driving the claims this year. And two major things are driving claim costs. One is the increase in large claims, and a large claim is defined as any claim over $25,000. So year-to-date 2020, large claims have doubled this time last year. So that's not good. Another thing to look at is there's 450 covered lives on the Franklin County plan. 11 of those 450 covered enrollees, which is 2.4% of the population, is accounting for 47% of the overall claims. In 2019, those large claims represented just 30% of all claims. So we've had quite an increase in large claims. Another interesting note is 5 of those large claims are prescriptions, pharmacy claims, which we'll get into in a second here. The other thing driving cost is a sharp increase in pharmacy costs. Now, prescription drug costs have been on the rise nationally for some time, and it's just the last year or so that it's starting to hit Franklin County. So again, comparing year-to-date 2020 with year-to-date 2019, drug costs are up 66% from this time last year. The average cost of a prescription taken by Franklin County enrollees is up 50% from last year. There's a category which we'll talk about in a few slides called specialty drugs. These are a lot of medications you see advertised on TV for some, serious conditions, but the average cost of a specialty drug taken by a Franklin County member is over $6,000 for a 1-month supply. And speaking of those specialty drugs, they account for 1.4% of all of the prescriptions filled, but they account for 64% of the drug costs. A normal range would be 1% of the medications taken by a population would be specialty drugs, and that would account for 40 to 45% of the total drug spend. So we've got 2 things really driving costs this year. Lots of data points. Is there any information or any questions I can answer on slide 4?
So Dave, this is Brad again. Really great data and very, very well presented, very clear. There are some very small numbers here in what I call small numbers math. 11 out of 450 covered enrollees. My question is, isn't it perfectly understandable that we could have such wild swings in a county program with relatively small numbers of participants? 11 out of 450 covered is 47% of our costs. If you dropped out 1 or 2 folks with high costs, and don't mistake what I said, I'm not suggesting we drop anybody, but if that was 9, if 2 of those high claim folks were out of there, these numbers would look dramatically different. I guess it's a long way of saying these are very volatile numbers, and they look pretty scary this year, but they could swing the other way just as quickly. Your thoughts?
Absolutely. And you hit it on the head earlier, Commissioner Peck, when you said this is the worst you've seen, and it is the worst year Franklin County has had with regards to claims data. So we're trying to just show what's going on this year. But yes, in years past, it hasn't been as bad. So yes, it could be completely different next year. Now, so did that answer your question?
It does. Thank you.
So Dave, this is Commissioner Didier.
Yes.
And in all fairness, are we not talking about business risk here as an insurance provider? You put a bid in for this, correct? And you won the bid. And you became our supplier of insurance. And I can see where you're alarmed. I know Donald Trump just signed an executive order on prescription drugs. Do you foresee a easing of costs on this prescription drug from that executive order that he signed?
I do, but those things take time.
Yes. Let me ask you one question here. In previous years where you have come out ahead as far as these numbers go, does Franklin County get a kickback?
No, that is called rebating, so there is no kickback.
Okay. All righty, thank you.
You bet. Okay, so let's go to page 5. We're going to talk about the activity of the benefit committee. This isn't necessarily chronological in order, but just want to give you an idea of what the committee has done. So, top of page 5, based on what we just saw on page 4, we were expecting a larger increase compared to past years. In fact, we can see in 2018, there was no increase. 19 was a 5% increase, and last year was a 3.5% increase. So those last 3 years were very, very good. My task was to make sure I prepared the committee for not as good as these past 3 years. So the next bullet point was, in the interest of exploring other options, we did go to market. We sent out quotes to 5 different insurance companies. We went to United Healthcare, to Cigna, Aetna, Kaiser, and Assurus, which are the major players in this size of market. Only one company was going to provide a quote, and that quote was 33% higher than Primera's 19.9 at the time we sent out 4 quotes. The other carriers did not want to play ball. And again, it's purely a risk issue. So the focus changed to then negotiating the best possible plans and rates with Primera. And the committee, we proactively, and this started actually before we got the renewal. We actually explored alternate, or what I called scaled down, medical and pharmacy plans, basically higher co-pays and co-insurance and things like that. So we started that process even before getting the renewal, knowing what was to come. Any questions on page 5? So on page 6, Benefits Committee reviewed several options, medical and drug options, and then communicated those findings to each of their representative groups to get feedback from those groups. With what was presented, we started out with a 15% increase, and with some of these different options, the increases range from a high of 15% down to a low of a 6.6% increase. The Benefit Committee was asked to make the following recommendations. One is on the medical plan. Do you want to keep the existing plan designs or move to the alternate plans? And separately on the prescription options, keep the existing prescription option or choose one of 3 new options that were presented. Okay? We tried to make it very easy and clear for the committee as to what their task was. Any questions on page 6?
Dave, not a question, just an observation. Obviously, there's a balancing act between what the plan includes and what the plan costs. More coverage, higher cost, less coverage, lower cost. These alternate medical plans and the new options for prescription drugs all had their own costs associated, and that was all presented to the committee, correct?
That is correct.
All right, thank you.
Okay, so slide 7. These were the medical plan. These are the current medical plan and the alternate medical plans. And what we were looking for was a way to lower costs without slashing benefits. Okay? So the top section, you can see, it says the existing plans, and you can see the deductibles, and then each plan has what's called an office visit copay, how much the patient pays when they go to the doctor. Notice the last plan, it's the 2,500 called HDHP, high deductible health plan. It's a different approach, so it all just says co-insurance or 20%. With those plans, a person has to meet that deductible before the plan starts paying. But anyway, so you can see the office copays, the co-insurance on all the plans. That means after the deductible is met, how much does the patient have to pay on items where the deductible applies. And then the last column is the out-of-pocket maximum. How much does the patient have to pay in cost shares before Premera, in this case, starts to pay 100% of the claims. And with the alternate plan designs, you can see we increased the co-pays by $5 or $10. On co-insurance, other than the high deductible plan, they went from a 20% to 30%. And then the out-of-pocket costs were increased, except on the $3,000 deductible, we felt high enough. And so the recommendation of the committee, and it was pretty much unanimous, was to keep the existing medical plans. So no changes to the medical part of the plans. Any questions I can answer on this page? Okay, let's go to page 8. This is the one I find interesting. So what I list here is the current plan design for pharmacy with 3 options. And what I'm going to do real quick is eliminate option 2. And here's why. It got no votes. And the reason it got no votes was it was the most expensive of the options, which I don't understand why, but it was. And so given that cost and benefit analysis, it just makes sense. So if you're okay to save time, I'm just going to focus on the current plan, option 1 and option 3. So without getting into too much details, your current plan design there's 3 types of medications: a generic drug, a preferred brand, and a non-preferred brand. You'll notice on the left-hand side below the non-preferred brand, it says specialty. Okay? You do not have a plan that isolates specialty drugs. So what happens is at the retail pharmacy, the person pays up to $20 as a copay for generics, $40 for the preferred brand, $70 for non-preferred brand. Mail order, they can get 3 times the retail supply, 3 months versus 1, or 2 times the retail copay. And at the bottom, you can see there is an annual deductible that's per person per year of $150 for any for medications that are not generics. So option 1 is really a similar approach to your current plan, except it increases the copays. The mail order is still 2 times retail, and we increase the deductible to $300. Just a little side note here. Yes.
Dave, just confirming that on option 1, while the mail order is twice the cost, is still 3 months supply.
Yes. Retail is 30 days supply, mail order is 90 days supply. So option 1 basically just same approach, it just passes more cost onto the people using the benefits. Remember, we have that high loss ratio on the prescription, so we're trying to get that back into whack. Option 3 is really a different approach in 2 ways. One, it isolates specialty medications, and it has a focus on, and in some cases, a requirement to use mail order. The reason mail order is cheaper is you're in essence paying wholesale prices versus retail. So here's what option 3 does. You'll notice the co-pays at the retail level are higher, 30 generic, 100 for the preferred brand, 200 for non-preferred brand, and then the specialty, it says NA/$300. Specialty drugs will be required to be purchased via mail order. There's a situation where the specialty drug requires same-day usage, then a person will be allowed to get it at the retail pharmacy. But notice the mail order, instead of 2 times retail, it's 1.5. So a person could, like on a generic drug, could go to the retail pharmacy and pay $30, or they could go to the mail order and get a 3-month supply at $45, which averages $15 a month. So it really incentivizes them to use mail order, or in some ways penalize them to use retail. And then you can see the co-pays there. And then notice back on the specialty copay, the bottom of column 3, on the specialty mail order, it's a $300 copay, and they can only get 1 month supply at a time. This is common, by the way, in the marketplace. Not common for Franklin County, but common for the industry as a whole. Okay, so, and then it also increases the deductible to $300. And you can see at the bottom, the benefit committee was evenly split between option 1 and option 3. Can I answer any questions on this slide before we get into the actual rates? And again, the committee saw this information, so.
Excuse me, Dave Bradbeck. Again, really good information. Like the clarity that you're providing, but I'm a little unclear on specialty copay drugs under the current design and option 1, which all say NA, and option 3. Could you just sort of give us an example, perhaps? And
Yes.
run it across the 3 design things.
Okay, so the plan you have now and option 1, it's basically a 3-tier, which means the tiers are generic, preferred, non-preferred. Specialty drugs will fall within either the preferred or non-preferred brand, most likely the non-preferred brand. Same with option 1. Option 3 takes those specialty meds and puts them in a 4th tier. And so they are treated separately.
So is it accurate to say that for those people using specialty drugs, the difference between our current plan design and option 3 is that they would be the ones likely to see a significant cost increase, since they're currently paying much less than $300 per month?
Yes. Just to be specific here, currently the most a person would be paying for a specialty drug is $840 a year. That's $70 a month times 12 months.
Okay, that's clear. I appreciate it. And
Okay.
I'm not trying to apply any value judgment here about whether we should or shouldn't, or who's driving the cost and who's not. I just wanted to have good clarity around that. Thank you.
You bet. So you'll notice at the bottom of page 8, half the people that voted, or half the units that voted wanted option 1, half wanted option 3. So if you turn to page 9, this is the rate grid for the PPO plans with, and there's a whole bunch of them, but just real quickly, it's, you know, keep option A would be keep everything the same. Options B, C, and D keep the same medical plan, but consider the optional drugs. And options E, F, and G go to the optional medical and one of the optional drugs. The high deductible health plans are not included on this page, again, because there's no ability to carve out the prescription. So that'll be on another page. So this deals with the current PPO plans. And option B and option D is where the committee came down, evenly split between B and D. And again, all of this was committed to the committee, presented to the committee. No, I'm gonna go ahead. I'll make a quick comment about the next page without turning there. The committee understood that if the recommendation was to keep with the existing medical plans, the high deductible plan would stay the same. If the committee chose to go to an alternate medical plan, then the high deductible plan would also shift to the alternate plan.
And Dave, on page 9 that we're looking at, the current medical with the current prescription, the dollar amounts you're showing are for the new renewal, not what they're currently paying?
Current medical is what the county has paid for 2020. Option A is what it would be if they continued the same plans without changes. Thus a 15% increase.
Okay, got it. Okay, thank you. That's what I was missing.
So I think what, Carly, if you want to jump in, or Eric, there's no questions on this page, on page 9, what the committee is looking from the commissioners at this point?
Yep, so a couple of decisions we need from the commissioners today. First, we need consensus to renew our coverages for our dental plans for Primera and Willamette. Obviously, those are a rate pass, but just need that go ahead to move forward with those. And then we need a decision from the board whether to essentially move forward with option B with the renewal medical and option 1 for the prescriptions, or choice C as recommended by the committee, since the committee was split, or of course, as been communicated to the committee, the board could go a different way outside of that recommendation. But essentially we need consensus on those plans so that we can do the preparations for a timely open enrollment period.
Dave and Carly both, are you able to give any fair assessment of concerns by the committee member for B versus D?
I mean, I will say that amongst a couple individuals in the committee, or a few times, cost, obviously employee out-of-pocket cost, especially for family coverages, did come up as a concern. So from that standpoint, generalized out, option D with only a 10.5% increase in premiums could seem to be the choice, but understanding that could affect individuals differently, as is always the case with healthcare. Everyone's situation is different, but if it was an employee that was affected more by those prescription changes, that could impact them more specifically.
Yeah, well, recognizing that every dollar matters, there's still only $6 or $7 a month between B and D. So I was thinking there might be something else driving it other than just the mere monthly financials. And I think you might have touched on it indirectly, which is which prescription option is attached. Go ahead, Dave.
Yeah, I'd like to just kind of make a general observation about these two options. So option one obviously passes on higher drug costs to employees. And because of that, I expect there's going to be an increased usage of mail order to help offset those copay increases. Option one would be the path of least resistance, as it's the same approach as what people are doing now, just with higher cost shares. Okay. Option three, no doubt, is going to eventually change how employees will purchase medications, meaning through mail order, which is going to help control cost, but it's not going to be without some initial disruption. Employees are going to have to get used to using mail order. I'm not saying they won't, but there is going to be a level of disruption for a couple of months. So the price difference between option one and option three, or I should say between B and D on page 9, is basically 1.5% as far as premiums go. So the question really is it worth 1.5% savings for the disruption that could be caused in order to save costs down the road? I hope that makes sense in terms of clarifying what to expect with each approach.
Well, as you say, disruption down the line is actually a benefit to the employees. The way I see it anyway, because it's going to, cost a little more to go into your mail order initially. It's a different mindset. I don't know anybody else. I've used mail order as long as it's been available, and it's easy and on time, and they let you know when your renewals are, and it's a win-win situation. So
another data point: 95% of the Franklin County prescriptions are filled retail. 5% are filled by mail order.
Wow.
And we actually tried to push or communicate advantages of using mail order, but it is what it is.
Well, I think the option to the mail order, pushing them to the mail order, will be a benefit to the employees.
I'll tell you that some of the big federal healthcare plans, TRICARE, for example, are now adding monthly enrollment fees for those of us who were promised lifetime medical. And they're mandating mail order prescriptions because of the cost savings for everybody.
So, Carly, this is
Yes.
Commissioner Didier.
Yes, Commissioner.
Yeah, so on the front page, it says financial impact is $1,030 per eligible employee per month. I know we have numerous people that are elected that are on other coverages, as Mr. Peck just enlightened us about. Are they now going to receive this $1,030 in their salary per month, per year?
So the county contribution for all benefit eligible employees is $1,030 per month. And that's 945 of that goes to medical. The county also allows a waiver of medical with other qualifying group coverages. So any benefits eligible employee that has other qualifying coverage receives that $945 either into VIBA or, as is the case with the elected officials and the appraisers, into as a cash in lieu of benefit broke down for payroll taxes.
So it will not go up.
That is not part of this conversation. The county contribution to benefits is separate from the selection of the plan.
Thank you.
Dave, can you, this is Brad Peck, can you speak to option 3 and what impact do you think it would logically have on the data that we saw in page 4?
Well, it will have a favorable impact on the first 2 bullets of sharp rising pharmacy costs, because it'll have a favorable effect on the cost. To what extent is it going to save money? I don't know. I don't know. And then the average cost per prescription will definitely come down because mail order versus retail. The question is, how will the employees of Franklin County respond? Will they say, I still want to use retail because I like my pharmacist, or it's easier and I'm just willing to pay more? Or are they going to make the shift? I don't have a crystal ball, Commissioner Peck, to say what those numbers will be, but it will definitely have a favorable impact. The whole idea behind both of these options is to get cost ratios down, or loss ratios down, into more of a acceptable level.
And I do think it's important to mention we had somewhat of a similar conversation last year, in that the prescription experience of the plan, has been trending unfavorably over a number of years, and that's where our issues have been. Last year, we did make some slight tweaks to the plan to hopefully positively impact that experience. And I think the goal of that change was to be very non-disruptive and just a very slight tweak. And I don't know that we saw a lot of benefit from that in our experience. Again, bad claims year, and, no one has a crystal ball, but, it's not just about, the premiums this year, but looking down the line and being able to, how aggressively do we want to try to impact the experience for next year is the consideration.
So, Carly, I think that's a good point. I can't help but note that in this present year of COVID, there's been a dramatic and frankly a successful shift to people ordering goods and services online, having it delivered to their door. Even a lot of Costco shoppers I know are now having products delivered to their door. So in terms of a transition to ordering your prescriptions and having them delivered to your door, frankly, it seems less disruptive from the current norm than it would have been in other years. I don't know if that really weighs into the decision. It's just an observation that we've all gotten, I think, a lot more accustomed to ordering things as opposed to going out to retail stores in person.
So perhaps we can go with the easy decision first. Does the board have consensus to move forward with the dental plans, Premier and Willamette, on a rate path?
Aye.
Mr. Chairman, I only heard two voices there. Do we have unanimous consent?
I only heard Bob say aye. Was there a motion?
Consensus
Motion
was
was not
asked.
required for consensus.
I only heard Bob say aye. I'm in favor of the dental plan.
I said yes.
Okay, sounds like we have a consensus there, Carly.
Thank you.
And at this point, moving on to the medical side of it, I would support item D.
I concur.
Didier, do you have an opinion?
Just looking it over.
Okay.
My concern is if this executive order lowers prescription costs and we have a turnaround and not as much, are we going to be able to readdress this and lower our rates next year because of the fact that everything swung the other way? Or will everything just stay the same and we will vote on it? Well, there will be an adjustment if we have a favorable outcome in 2021. And that's my asking Dave.
The answer is yes. Next year's renewal will be based on money in premiums versus money out in claims. Both options, 1 and 3 on the pharmacy side, will have a more favorable outcome than doing nothing, or a favorable outcome than doing nothing. But so the money spent on pharmacy costs, yeah, that's going to help down the road, of course.
So what, Dave, what is your threshold for profit here? What percentage are you looking for where you feel comfortable in providing this medical insurance for a profit? Because you're giving us all these percentages, and this year the loss ratio was 100%. So every dollar that we paid you, you paid out. What are you looking for? 20% profit, 10%? What's your profit threshold?
Okay, remember, Commissioner Didier.
Explain your role.
Yeah, remember, I'm the broker. I'm not the insurance company.
I know.
So, yeah. So Premier's profit margin, that's what we're really talking about, is basically their loss ratio target of 7. Well, I'll just cut to the chase. They're looking for a 3 to 4% profit margin.
Okay, that's my question. Thank you.
Okay.
I would favor D.
All right, Carla, you have a consensus on item D for renewal of medical?
Great, thank you.
RX option 3, so.
Thank you very much, Commissioners.
Yes, thank you.
All right, have anything else for the good of the board, Dave?
Thank you for the opportunity to serve Franklin County.
All right. I did find it kind of interesting, some of the Rita had talking about going with WICA for AWC, but, you know, we were involved with WICF years ago, and it was not comfortable, so, I'm glad they were eliminated.
Yeah, you know, and we did explore those options, and we'll continue to do so. I think, you know, certainly with a pooling program, those can be advantageous. Unfortunately, like your rates on entry to a pool are based on your experience, and to be perfectly honest with you, I would be skeptical of a pool that would let us in right now based on our experience, because it would say to me that that pool might not be super stable. You know, so hopefully we can make an impact on that experience going forward and have some different options for 2022.
Yeah. All right. Thank you, Harley and Eric and Dave. Appreciate your time.
Thank you.
Okay. Well, I will hang up now. Thank you again.
Thank you. Okay, that'll put us into our comment period. Is there anything, Keith?
I have no callers on the line at this time.
Okay. We will move into office business and we have pay the bills.
Yeah, we can do that, Mr. Chairman. We have three fiscal notes or three fiscal items that we need to address this morning. The first is fund expenditures, and I'll note that these are dated September 29, 2020. They've been preliminarily approved by the Chairman, Commissioner Cook, and to be ratified by us here today. So with that, move for approval of ratifying those expenditures, fund expenditures, in the total amount of $189,606.77 as presented.
Second.
Okay, all in favor?
Aye.
Aye.
And Mr. Chairman, next we have fund expenditures.
Aye.
And Mr. Chairman, next we have fund expenditures. Aye.
We're getting some feedback if somebody's got a speaker on. Okay, Commissioner Pat, go ahead.
Okay, next is fund expenditures dated October 6, 2020. Move for approval of those fund expenditures as presented in the total amount of $439,068.43.
I second.
All in favor?
Aye.
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 And third and final, move for approval of salary clearing payroll and emergency management payroll dated October 6, 2020 in the total amount of $979,454.37 as presented.
I second.
All in favor?
Aye.
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 That was third and final, Commissioner?
Yes, that is correct. That was third and final.
Okay. We will move on to approval of consent agenda 1 through 8 as presented.
And Mr. Chairman, move for approval of consent agenda as presented.
I second with discussion on item 8.
Okay. Go ahead.
So Matt, looking through this, that fire on September 7th, it caused extensive damage to an overhead rail trusses on Burr Canyon Road. Are we responsible for the railroad crossing?
No, those are actually state. Those were part of the rails to trails, where they turn those all those railroad tracks there into trails, and those are by the state. So the struggle we're going to have, I'm glad you brought it up, the struggle that we're going to have is where we get all of our repairs done. The opening of the road is going to be really contingent upon whether or not those railroad bridges, those trestles, are safe for people to drive under. So we're hoping the state gets on that sooner rather than later. But So our numbers don't include the damage to those. We're sure the state is doing everything they need to do to get that all checked out and hopefully get it back into repair so that it's safe for cars to drive under. But we have the same situation on Wallace Walker. So
Okay.
that same railroad, Wallace Walker, we have the same issue there where the timbers burnt and fell down on the road.
So the approximate is 1.5 million. And tell me what a deck of box culvert is.
You know, out there on Burr Canyon, as you're driving along the river there,
Yeah.
the box culverts are just little bridges, for lack of a better term, that kind of span a ditch, a drainage area where water runs. So we're looking at now of either replacing that with putting a concrete deck. That was a wooden deck on concrete footings, and the deck completely burnt out. So now you got basically a big gap in the road with the concrete footings on both sides. So we're either going to pipe that or just pour a concrete deck on top of it, so we don't have to worry about that issue again.
Yeah, I understand. And culvert pipe would probably be the most cost effective, would it not?
Absolutely. So,
Yep.
yeah.
All righty. So this is just an estimate. We're waiting to hear from the state then on this rails to trails.
Yeah, Craig, the county engineer, he's been in contact with them and trying to provide any support we can provide, him and his staff. But ultimately, that's going to be them. And like I said, it's going to be, we need to get that road back open to traffic, but that's really going to be the driving factor. So we can replace the thousands of feet of guardrail, and we can fix that box culvert and some of the other damage that was caused, but opening that up to traffic and feeling comfortable for the safety of the people, it's getting assurance from the state that cars can drive under that railroad bridge. So,
Okay. Well, thank you very much. That explains everything. Appreciate it.
all right, you bet. Thank you.
Okay. Any further discussion?
Matt, Commissioner Cook, just an observation, not really a question so much, but looking for you to verify that my understanding here is correct, that under the state emergency declaration rules in RCW, I think it's 3640, I think it's 140 and 180 both. One of them talks about specific declarations of emergency identified in the statute, and then the other, I think it's 180. No, it's 140 that talks about them in general. 180 is the section that talks specifically about certain types of emergencies. And this is under 3640, 180 that doesn't require the hearings, but does require unanimous vote from the board. Have we had, I guess there is a question here now that I'm getting through it. Have we had instances where we've had emergency declarations that weren't covered by the state statute, where we had to take a different approach, I guess is what I'm thinking? But the statute speaks to specific categories and types of emergencies that we can do this expedited process with no hearings. Have we had occasions where we used the other statute and had to do the hearing process? I'm asking specifically, since I've gone this far into it, I'm thinking forward to the legislative session coming up and seeing if we need to broaden those categories of emergencies that are automatically covered, I think under point 180.
Is that a question for me, Commissioner Beck?
Yeah, sorry about the long
No, that's
explanation there.
good. And to my knowledge, and I did go back and looked up in putting even this together, all the declarations, I was unable to find one that met the criteria for requiring a hearing. You know, our office alone has done a few of these with the flooding, and then of course we've also done them for major equipment failures where we came to the board where we had catastrophic failures. and of course the landslide that we had back in the early 2000s on our 170. So, but I was unable to find any of them that met the criteria to where we needed to have a public hearing.
Yeah, okay. Well, if you think of any that need to be added to the statute for this accelerated process, let me know, please, and we'll get them to the legislative steering committee at WASAC. All right, thanks.
Will do. Thank you.
Hearing no further questions, all in favor?
Aye.
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 Thank you. That moves us on, unless there's something on the phone, Keith, that moves us on to your agenda.
Okay, thank you, Commissioner. I don't have any callers on the phone, so I will proceed.
Okay.
I'm going to take my mask off because it muffles the microphone here. I apologize, but I'm alone at the dais here. Wanted to update the board a little bit on some of our progress on CARES Act funding for business community in particular. I'll focus on that for a moment. As you know, we've been working with TRIDEC to get funds out the door to businesses that have incurred significant costs due to the COVID restrictions. As of right now, we have applications in the amount of about a little over $2.6 million. We had allocated $3 million initially for that program. So we are working with a few businesses that have applied that have not yet been approved because they have either business license issues or L&I issues to get resolved. But we're working with those particular businesses to get those resolved and be awarded their applications. What that means that between the difference of what we've allocated and what we think is going to be awarded under those first two rounds, we're very likely, plus the fact that we have received an additional allocation of CARES Act funding from the state, that leaves us with still a fair amount of money to push out to the community.
Hey, Keith,
yes.
this is Commissioner Peck. Apologize for the interruption, but I'd like to get some clarity on something before you go on.
Sure.
People who apply, businesses who apply for those CARES Act dollars, we were told were going to be the ones that had qualifying paperwork were going to be drawn in a lottery system, and there was no guarantee that everyone would get selected and funded. Am I hearing you say that in Franklin County, out of our Franklin County CARES Act money, any application from any business that qualifies is going to receive funding, that we're able to cover 100% of them? Is that a correct understanding?
Yes, that is also my understanding, that there are some that were disqualified that did not meet the requirements, but that was a very small number. But as you adequately described, those that met the qualifications, we've been able to meet all of those grant requests.
Okay, well, that's great. Thank you.
And we still have, like I said, some to go out. I've got to continue some discussions with TRIDEC. I know between us and Benton County and their other responsibilities, we've kind of stretched their resources to capacity, but I will continue to have conversations with them about a possible round 3. But I would also like to bring before the board a proposal. I don't have it, the details worked out just yet, but a proposal working with the Tri-Cities Chamber of Commerce to do some additional business grants through their organization. And that will help some of those businesses that maybe they didn't qualify under the first round, or those that have other kinds of expenses that were that need to be considered. Secondly, there's been a fairly significant discussion in the Tri-Cities community about the need for child care services. Because of the fact that schools are not open to students yet and parents are trying to get back to work, there's been a significant need for providing child care services. Benton County is one local county that's working with the licensed child care providers. Think of YMCA, Boys and Girls Club, licensed daycare providers that are licensed by the state to provide some additional funding in Benton County. We have been asked to consider doing something similar here in Franklin County. There also, as you're probably aware, go ahead.
Excuse me, Keith.
Yep.
Sorry again to interrupt, but
No, that's fine.
if we're going to provide additional or contemplate providing additional funding to licensed daycare providers, it sounds like the objective is to increase capacity. So would we be providing funding to cover costs they've incurred or specifically to increase capacity? Because the former doesn't make a lot of sense, the latter does. Or I should say the latter makes sense, the former makes a little less sense.
Yeah. This is in some regard to help them hire people. They're having a very difficult time hiring personnel to staff the need. So that's a part of it. There's been changes in the enrollment numbers that have affected the ability of some of these providers to stay financially operational. So there are a number of factors going in, but it's not an effort necessarily to directly increase capacity. We're not opening new centers, but we're trying to help those that are already open and licensed be able to stay operational.
So Keith, this is Commissioner Didier. We're gonna apply CARES Act money to these organizations for kids to come to instead of school.
Well,
basically what this is about is for basically a babysitting service so that the parents can go to work, so that the kids going to school, they're going to go to these facilities with no regard to COVID.
No, that's not. They would still be required to follow all of the COVID requirements, and it is not a replacement of school, but there is a need for it in the fact that parents who have been unable to go back to work are unable to provide some child care when they need to go back to work.
Sounds like a daycare idea for younger children.
Well, it does with the middle and high school age students. Even there are programs through Boys and Girls Clubs and YMCA that would participate as well. But generally speaking, it is the younger children that we're talking about.
So, Keith, Commissioner Peck, excuse me. I think Commissioner Didier touches on a very relevant and important point, which is if you can cohabitate kids in a daycare, why can't you do it in a school and vice versa? And I guess I would just add to that observation that, and sometimes we forget this, the legislative authority of the county and the school district are entirely separate. And while you might wonder if we can have kids in a daycare, why can't we have them in school? Fact of the matter is, as a legislative body with access to CARES funds, we can impact the daycare solution or partial solution, but we really aren't in a position to impact the school side of it. That's ultimately an OSPI decision. So, while I think you raised a good point, we're not able to choose between the two. Our authority doesn't extend to schools. Thanks.
Yeah, and let me be clear that at this point, this is a proposal, Commissioner Didier. This is not a decision of the board today. I just kind of laying out some of the suggestions that have been proffered. Another one that I think is worth considering is the fact that there are a number of utility customers that are significantly behind on their utility bills as a result of layoffs or unemployment, not being able to work. The Franklin Public Utilities District has indicated to us some of the numbers that they're seeing. They are prevented from turning off somebody's utility service. And so there are considerations of assisting citizens in the community that are affected by COVID with some of their late utility bills, so that they don't become so far behind that if and when the executive orders are lifted, that they would then be immediately cut off from service or have such late fees and delinquency that they would have a difficult time catching up. So there's a proposal to consider assisting utility customers with some of their late payments. And so
Keith,
okay, go ahead.
Keith, Commissioner Peck, on the issue of utilities, I think we tread dangerously close to the distinction between a sub-agency agreement and a grant arrangement. Is the notion that the money would go to the PUD, effectively making them a sub-agent, and they would distribute those funds, or would it be grants directly to individuals?
It would have to be organized in such ways that it's a grant to the individual. Right,
because the sub-agency agreement's not eligible for CARES funds.
That's correct.
So can you give me just sort of a quick sense of how you would do a competitive grant program to individuals?
I think what you'd probably have to do is have the ratepayer demonstrate through documentation of their statements from utilities district that they're behind, and define a methodology that says that they are behind because of COVID related issues. And I would estimate that we'd be more along the line of trying to do a flat fee, say, I don't know, $500 or $1,000 or whatever the right number is. I don't know what that right number is, but per family or per household, to assist them with their utility bills.
And so we would have a set of criteria for that they would have to meet to be eligible for consideration. So probably based on COVID impact, household income, and current utility debt situation, maybe something to that effect.
Exactly.
Okay, thank you. It's as you know, it's an important distinction between the sub-agency law and the and a grant process.
Yeah. In the discussions,
grateful that you're on top of that.
Yeah, in the discussions I've had with Franklin PUD, that was clear that loss of revenue is not something that we can use CARES Act funds for, but we can assist local utility customers in their particular situation. So it is a careful distinction, but it is one we're well aware of. So with that, like I said, I want to kind of bring you up to date on where we are. We are looking at about 6-7 weeks left in the period before we have to report our final numbers to the state. But we're working very hard to minimize the use of these funds for government purpose and maximize the funds going out into the business community and the citizenry that need assistance for this period of time. And I believe,
so Keith, I would just add that while I share the sentiments that have been expressed in the board meetings in the past about getting as much of this money out to businesses as we can, when we've satisfied 100% of those requests from qualifying entities, then it's time to remember that if we're doing our jobs properly, then what we spend in county government is a benefit to all citizens. So it's not that it doesn't come back to the citizens. So we might think in terms of additional services or critical services that might be lagging at the county for CARES Act funds. Again, second to taking care of businesses, but it sounds like we're ahead of the curve on taking care of businesses right now.
Yeah, let's be very clear that this is not free money. It's allocated from the federal government to the states, but it's all taxpayer supported. So we know where the money comes from and where it's going. But thank you. That's all I have, I think, Commissioner, unless you have other questions.
All right, thank you, Keith. Any on the phone at this time?
No callers.
Okay. Commissioners, anything else for the good of the board today?
Yes, Mr. Chairman, I seen where we got a email that the Open Meetings Act has been, well, it's been pushed back clear to November 9th now.
I wonder why after the 9th, huh?
Yeah, the 3rd's the election, right? So that's probably why.
Oh. Yeah, I got that last night from attorney for transit. I thought I would share it because Karen and I were visiting yesterday. Neither one of us had heard about. We knew that the first of the month was the end of his last proclamation. So I didn't know if anybody had heard or not. Is why I forwarded it. So.
I had heard,
Well,
but I hadn't seen an official.
The 9th does leave about 6 days to count ballots.
Yeah. So if there's nothing else for the good of the board, we are adjourned. Thank you.
Thank you.
Thanks.